जी हाँ, मैं आपका होस्ट जलाल आपकी खिदमत में हाजिर। आप सब देख रहे हैं या तो आप जो सुन रहे हैं, या दिस इज सलाम नमस्ते कैलगरी on a radio source in Calgary or Punjabi National TV. Thank you so much, everyone, for joining us for the special edition of Salam Namaste Calgary. Yes, you know, like we do once a week, so हमारा every show जो है, every Tuesday हमारा जो special show ही होता है, doesn't matter. तो आई थिंक इट्स नाइस टू से, लोगों को थोड़ा एक्साइटमेंट बढ़ जाता है, मुझे थोड़ी एनर्जी आ जाती है, और जो मेरी को होस्ट है ऑफकोर्स उनको भी एनर्जी आ जाती है व्हेन वी से special edition. So there we go. So let me get my co-host. फिर हम, you know, the one we just played, couple of songs, beautiful songs. So we'll talk about that song as well before we get to our guest. So let me get to my co-host Salma ji. Salma ji, याली मदद
जी, याली मदद। कैसे हो जलाल?
आप आज बहुत खुश लग रही है, क्या बात है?
इसलिए कि खुशी की बात है, होनी चाहिए। अभी सबको पता चल जाएगा कि मैं खुश क्यों हूँ।
हाँ, वैसे तो लोगों ने देख ही लिया होगा, तो आई थिंक इट्स वेरी नाइस। कैसे आप? ठीक है।
सबसे पहले मैं सब अपने सुनने वालों को और देखने वालों को सलाम, नमस्ते, सत श्री अकाल, आदाब, याली मदद और गुड इवनिंग करना चाहती हूँ। और जो भी हमसे इस वक्त कनेक्टेड हैं, मैं उनका शुक्रिया अदा करना चाहती हूँ। So inshallah you will get a lot of information today, और जिसको कोई information चाहिए और कोई question पूछने हो तो please feel free to do that, because this is going to be, we'll make it a fun thing, at the same time make it very informative, right? Jalal?
Yeah, that's right. Yeah, or you know we were just talking about the जो आज जो दो गाने आए थे, you know, those two songs.
Hello?
The one yeah, Salma ji, you are frozen right now. Yeah, Salma ji, it's a frozen right now, so probably she will come back. So you know the one we played the two songs today. जो अपना पहला गीत था, it was from तौफीक करमाली, one of our legend. Beautiful song, मौला मेरे, जिन्होंने जो खुशहाली की टाइम पे ये रिलीज किया था. And of course it's about आजकल जो चल रहा है अपना because of the coronavirus pandemic. So we have so much stress. We have of course जो हमें जो आना जाना लगा रहता है, अपना बीमारी का स्ट्रेस भी है, काम का भी है. There we go. Okay, she's back now. और जो दूसरा जो गीत था, there was a new release today by the Smiley, and it was a beautiful song by Faisal Amrani, Nafisa, and Tanzil, and Alicia was on the keyboard. You know, Lappe Aati, they were beautiful. The way they composed the song, I think बड़ा अच्छा था. Looks really nice. जी सलमा जी, can you hear me, सलमा जी?
I can hear you, Jalal, लेकिन कट रहा है, freeze हो रहा है थोड़ा बीच में.
हाँ, I think it's okay now. So yeah, hopefully it stays. Okay, so आज हम बात करेंगे, of course, you know, about the coronavirus. Now, you know, I think last week we talked as well. Now everything starts to reopen. So what do we have to do? So how much careful all of us have to be. So let me get to our guest. This is an honor for us to have him here live in our virtual studio. याली मदद सर।
याली मदद,
कैसे आप? अपना डॉक्टर ताज, कैसे आप? ठीक है,
सब ठीक ठाक है. Thank you for having me.
No, thank you for coming in. I think this is an honor for us. Thank you so much.
Something is not right.
तो सलमा जी, you know what? Do me a favor. आप जो टैबलेट छोड़ के आप अपना सेल फोन यूज कर लो. Use the cell phone.
Me?
Yeah,
Should
that's
I use
right.
my
Yeah,
cell phone?
Yeah, that's right. Yeah, use the cell phone.
No,
yeah,
there's something not right.
Because Dr. Taj is right now. He can see.
No, Jalal, last time the iPad. No, something is not going right now.
Chalo, you know, I think thoda break ho raha hai, but let it going now. Is that okay?
Okay, I don't mind,
Yeah.
but I don't want we lose Taj's voice also, because when he's saying something that we don't want it to be lost also.
Yeah, that's right. Yeah. Okay. So, sir, you can hear us, sir?
जी, बिल्कुल.
Okay, he's okay with us. So, yeah. Dr. Taj, you know, I think you were our last guest in the studio when the pandemic started. Then after, when you came to our show, we talked about the coronavirus. Then everything starts to shut down. Then we lost our studio as well. It was back in March, I think 16, 17. I think it was second or third week in March. Now we are second or third week in August. So what do we know? Like, what was the coronavirus back in March? Now we are in August. So what, like, you know, how much more we know about it? Because that virus is still going on. People are still getting sick, even though little lesser now. but people are still getting sick, and unfortunately, people are dying as well. So, how much we know more about it, this coronavirus?
So let me just, first of all, thank you, and thank you for the listeners to be listening to this conversation. I'll make it very simple, So I think we are now probably about 5 months into coronavirus. There are lots of things which we know. There are lots of things we don't know. And there are lots of things we think we know.
Right.
So what we know now, we know that, well, it is a virus, which is transmitted from person to person, and nobody has got antibodies against this virus. So we know that, And that is what has happened, that because of that, this virus has become a pandemic virus, which means it affects every part of the world. And you can see, that there are lots of cases of that. We also know that to reduce the transmission, there are certain things we need to do. And the reason is because at the present time, we do not have any special treatment for this, and we do not have a vaccine to prevent this infection. So once one asks that, well, what are the things that everybody knows about this? That, well, social distancing is very important. And the reason I say that, because this virus is not spread by airborne. There is publication, or you will see in literature, 1 or 2 people have said that yes, but when you go back and read those studies, it tells you that the way they did this study, they really spread the virus into the air, and that is the reason they think that it could be airborne as well. But majority of the time, it is a droplet, and I'll tell you the difference between that.
Mm-hmm.
The airborne. So, for example, if you have got a person with measles or chickenpox sitting in a room, and you enter that room, and if you do not have antibodies against that particular infection, there is a chance of about 90 to 95% that you will be infected with that virus. So that's an airborne. So the precaution in the hospital of airborne is very different than the precaution of droplet. So droplet these are large particles, and even if you enter that room, it is not likely that you will get that virus, because the distance is large, and that is the reason social distancing with droplet is important. That's why people talk about 2 meters or 6 feet. Distance has to be there. That's number one. Number two, the masks which we are wearing.
Yeah.
We are protecting each other with the masks. I'm protecting you, and you are protecting me by wearing a mask. So that is, people have to understand that. And that is important. For us to play that role in the public is very important. If we don't, and if people break rules, remember, even if few people are breaking rules, then you will continue to see the spread of the virus. So it is very essential that everybody has to really wear the mask. The third thing is that there are a number of people, and especially children, who do not have symptoms, but they are still carrying the virus. So we call them as asymptomatic carrier. Initially, people thought, that, well, these asymptomatic carriers are not spreading the virus. That is not true anymore. There are lots of studies now have shown that asymptomatic carrier from children to other people happens. And though they may not have the symptoms, but they still can spread the virus. And I'll come back to this, when we are talking about school opening, and other places, because that point is very important.
Yes.
The fourth thing is that washing hands is very important, because all the studies which have been done in the past before the COVID-19 have shown that we touch our nose and face, or the T area on the face, all the time. You see, unknowingly, so that happens all the time. So we need to wash our hands. So, and we need to wash our hands properly, and people should, if they don't know how to do it, then people should watch the video how to wash the hands. So 30 seconds are very important. The fifth thing, so people ask this question about whether the virus is present on the surfaces. All right, so yes, it is present on the surfaces. And what has been shown is that it is probably present for about 48 to 72 hours. But the chances of transmission, I'm not saying it doesn't happen. I'm saying the transmission of virus from the surfaces is not like droplet. So most of the transmission occurs by droplet. Very little occurs by touching the surfaces. Sorry. So those are important things to start with. When you talk about, well, what is the advancement of the treatment side? There have been few drugs which have been available and have been shown to work in those people who are admitted to the hospital and who are extremely sick. It has decreased the time of the symptoms they get, and they get better quicker than those people who did not get the treatment. And one of the medications, you don't have to remember the name, it's called Remdesivir, which is an antiviral drug, and it has been shown to work, and most of the centers are using this drug in those who are admitted. I'm not talking about those who have got infection and who are not admitted. We don't use this drug. We only use it for people who are admitted to the hospital or who are in ICU, they are sick, where we'll use this drug. We will also use something called dexamethasone, which is a steroid family drug. And it has also been shown to decrease the inflammation of that. So those are the two types of treatment which are. There are other drugs as well, but these are the two important drugs which people know about and people have started using it. From the prevention point of view, we talked about the transmission. That is a prevention as well. When you talk about prevention in a big way, so now we are talking about vaccines. And remember, the vaccines, there are a number of centers which they are doing studies on the vaccines. And there are a number of vaccines being tried now, different kinds.
Yeah.
And phase 1 study, so there are usually, when you do the trials, there are 3 phases of the studies they do. They do the phase 1 study to start with, and if that is successful, they move into the second phase studies, and then looking at the adverse effect and all that, and then they will do the clinical trials, which is the phase 3. So people have started using, and now there are certain vaccines which have been used in the 3rd phase now. So the question can be asked, that, well, when do I think these vaccines will be available to the people in public health, in real world? From my experience of what, because naturally, I'm an infectious disease specialist, so I know quite a bit about the vaccines. Even expediting this process, I think the earliest you will see the vaccine used in real world situation will probably be somewhere in December or January.
Wow.
That's the earliest. That's the earliest. And Jalal, you have to remember this, that when you start using it in the real world, these vaccines, so remember the clinical trials, you have enrolled a handful of people. You say, so the numbers are not very high. So the signal of the adverse effect of the vaccine, sometimes you do not see it in the clinical trials. When you put the vaccine into the real world, now because you are vaccinating thousands of people, you start seeing the signals whether it has got an adverse effect or not. That's number one. Number two is, we at the present time do not know that whether this vaccine, when we administer it, it will produce antibodies. I think, that's for sure it will do that. But we don't know how long these antibodies will last in the body and how long it will protect us from these antibodies. So it may last for 1 month, it may last for 2 months, or it may last for a number of years as well. We don't know that. It's only after we have introduced this vaccine in the real world, we will start knowing that. So when people say that, yes, if you introduce the vaccine, let's say in December or January, then when do we think, that, well, lots of people will start not getting this, or we reduce the transmission? And basically what will happen is that time will tell us that how effective these vaccines are. And so if you ask me that, well, are we going to open up everything once we have really decreased the virus or leveled the virus? I think probably we are looking at August of 2021. We are looking at August of 2021 before things become normal. Now, I'm trying to be optimistic here. August of 21, I'm trying to be optimistic. So, but I doubt very much that anything before that will happen. And my point is that masking, social distancing, washing hands is very important till we have got vaccines in the real world. That's very important.
Yeah.
All right?
So I have a question. Now I'm talking to him not as a husband, as a guest. So now the flu season will start and the flu vaccines will be given to everyone. So the flu signs and symptoms are really similar to the COVID symptoms. So how will people know that they will get scared that, okay, I have COVID, but they may be having a regular flu? So what do you say about that?
So let me start, that's a very good question, and, I did really not ask Salma to ask me this question. She has come up with herself with that. So
yeah, I always get the flu, so that's the reason I'm
No, that's an excellent question, and I think you are absolutely right. So the problem starts by, let's say that usually we see the first case of flu sometimes end of September, beginning of October. That's our flu season starts, happening in the community. And once we see the flu and people get sick, you will not know whether this is COVID-19 or this is flu. Only way you will come to know is by getting a swab done. The good part is that for both this infection, we have got a rapid testing. So when you do a swab, the lab will be able to identify whether this is COVID-19 or this is influenza or this is some other virus. Remember when we talk about starting September, end of September, beginning of October, it is not only the influenza which starts. We have got number of other respiratory viruses which will also occur in the community. And these are your like para-influenza virus. These are your enterorhinoviruses. These are your adenoviruses. So all of these viruses have got very similar symptoms like coronavirus. Okay, so it will be bad. We have got labs which can give you an answer very quickly. And especially this is important. Remember, the precautions are very similar for your coronavirus and influenza as well.
Yeah.
Social distancing, wearing masks, washing hands, those are very similar for influenza as well as. The important thing is, it is the vaccines available for influenza. And people may ask me these questions that, well, because the effectiveness of the influenza vaccine is variable. Some season, it could be 50, 60%. Some season, it can be 10%. So because it all depends on the type of strains which are circulating in the community and the type of strains which are present in the vaccine itself. So if you've got the strains which are circulating in the community and the same strains are present in the vaccines, then that vaccine will be quite effective. All right, so that is where the influenza vaccine comes into. But let me tell you that let's say that even if it is 30% effective, I will advise everybody to get influenza vaccine, and I'll tell you why. The burden of influenza is very huge. Even if you prevent 30%, that's a lot. And basically what you are doing is, you are decreasing the number of people going to the hospital by preventing that infection. So that is an important thing, And you are absolutely right. Clinically, I will not be able to differentiate between your coronavirus and your influenza virus. Clinically, it will be difficult.
So do you think we will see less of flu because we are taking so many precautions this time? So maybe we are preventing to have more cases of flu. Do you think that is one of the factors which will help because we are physical distancing and wearing masks and washing hands? Will it help us not getting too much flu infection around?
Well, that's a possibility. I will not be able to really answer that in a very, convincing way, but it is a possibility. It is a possibility. Or we pray that it is not a heavy flu season.
Yeah.
So flu season sometimes, are milder. Sometimes they are heavy. We see lots of infection, So we pray that, we don't get a very heavy flu season this year.
That's right.
Yeah. So, if you remember, when we had a SARS, especially in Toronto, so it was a new virus as well. And then we got control on it. It was faster than this coronavirus. So what's the difference? Like, why this virus is so bad or so, I don't know, it doesn't want to go away, and we are still taking so much time for the vaccination. So what's the difference, or what's special about this virus? I know, like you said, but why this one is taking so much time?
So Jalal, that's a good question, and people should know this. So remember, we have had 3 outbreaks. We have had your SARS, which happened a few years ago. After that, we had something called MERS, the Middle Eastern coronavirus. So that is a coronavirus as well. So that was the Middle Eastern Respiratory Distress Syndrome. And then now this corona. So all of those are coronavirus. So remember that. All of them have come from animals to humans. So the difference, I'll tell you why there is a difference. The difference of SARS you are talking about. Remember, SARS was not pandemic.
No.
Yeah, so that's a big difference. It did not involve the entire globe.
Yeah.
There were pockets of SARS in some countries. All right, and that is the reason SARS went away very quickly.
Yeah.
All right, that was the reason SARS went away very quickly. We never had a vaccine for SARS. because it disappeared.
Mm-hmm.
So if you look at SARS, we are talking about that the mortality rate of SARS, so people dying after SARS, so it was 1 in 10.
Yes.
10 people get infected, 1 will die.
Yeah.
Okay, then you'd come to MERS, which is the Middle Eastern Respiratory Syndrome.
Mm-hmm.
Again, coronavirus, but it was not pandemic.
Yes.
Only some countries were affected. It is still, MERS is still there, but it is not infecting so many human beings globally. The difference of mortality with MERS is 38%.
Oh.
So if you look at, if 10 people are affected, almost 4 people will die.
Mm-hmm.
All right? Now you compare your COVID-19 coronavirus,
Mm-hmm.
it is a pandemic. So more people are affected with this.
Yeah.
Which means, but the mortality of
It's frozen.
the COVID-19 is not as high. We probably maximum we are looking at 4%. Maximum.
Oh. Okay.
Usually it is 1 to 2%. Usually.
Mm-hmm.
All right. And the number of people infected, if you've got one person who has got coronavirus or COVID-19, the chances are he's going to infect 2 or 3 other people. Okay. And so unlike flu, flu doesn't affect that many people, so lesser number of people. So that's the biggest difference we have. So it is globally affecting everybody, and that is the reason we need to have a vaccine to decrease this transmission worldwide.
Yeah, worldwide. Yeah, yeah, yeah. So Dr. Saab, we have some questions here. So until we get Salma back, so it's about the kids. Like, the kids are like not most likely will getting this coronavirus, and if you compare to like elderly people or senior people or like 60 plus, what's the reason? Why is that?
That's a good question. So I think you have to understand. So when you look at children, so initially we thought that your children don't get that much infection. Initially, that's what we thought. But that's not true anymore. They don't get that amount of infection, or they don't get symptoms like the elders get, number one. Mm-hmm. Number two, the severe symptoms which the elderly get, 60 and above, also they are hospitalized much more than children. Mm-hmm. When children get it, they get mild disease and they get better very soon. Their immune system is very powerful. That's number one. Yeah. Number two is, if you look at people above the age of 60, they have got lots of other comorbidities, which means they have got other underlying disease. Diabetes is one of them. Yeah. Chronic renal failure is another one of them. COPD, which is you've got the chronic lung disease, is another one of them. Coronary artery disease is another one of them. Their comorbidity is much higher than the children. And that's why they get sicker much more than children. Yeah. They are admitted to ICU much more than children. Yeah. But when you ask me, because naturally I work at the children's hospital, so I see number of cases, I have seen a lot of complication of COVID-19 in children as well. So multi-organ failure, all right, multi-system involvement, I have seen it in a lot of children. I have seen Kawasaki disease, which has now been described with this in children. So it is not that children don't get complicated. They do get complication. I have seen stroke in children with COVID-19 as well. So all of these things, but absolutely you are right, that they do not get sicker like the elderly people get. They do not get hospitalized like elderly get. So that is the reason. However, they do transmit the virus even when they are asymptomatic. So be careful about that.
Yeah.
So now tell us, yes, Jalal, go ahead.
Yeah, no, go ahead. आपने बोला था.
So now my question is, everybody is so apprehensive now going back to school. So what do you have comments on that?
Yeah, so whenever you talk about, so I think you have to weigh the risk benefit of children not going to school or children going to school. And so you have to really sit and say that, well, is it beneficial or is it more riskier for them not to go from the intellectual point of view? So if you ask me, I think they should open up the schools.
Okay.
I think that is the right decision to make, is to open up the school. However, there should be enough precautions to be taken. So because it is not only children who will be going to school, they've got teachers there.
Yeah.
And some of these teachers are in the ages of 50, 60 years. They've been working there for long. Also, those teachers can transmit the virus to children. They may not become that symptomatic, but they take that virus back home. And they come in contact with their parents, and they come in contact with their grandparents as well.
Yeah.
So remember, so we are taking a chance here. However, when you look at, as I mentioned to you, let's say that this was an airborne virus, then my answer would be very different today. And I would have said, no, you can't open the school. All right, so that is, I would have told you that if this was an airborne disease. This is a droplet disease. So the transmission of the virus, if we take precaution, you can probably avoid the transmission. Social distancing, which is difficult in especially younger age group. When you're talking about grade 1, social distancing in them is a very difficult situation.
Yes.
But I think it is an opportunity for us to teach these children how to wash their hands properly. And they form this habit now, and it remains with them forever. This is a great opportunity for us. You teach them and you educate them about, those children. Remember, that abstract thinking in children, they come after the age of 7 years or so. So they really don't understand much, But then in a play way, you create a play for them and teach them, why we are wearing this mask, something which you can't see. You are trying to prevent going out from your mouth, from the nose to the other people. So, you're keeping everybody safe. So there are ways of doing these things. So I think as soon as you teach them, children learn very fast. And once you teach them that anytime, they touch something, they need to wash their hands properly. So that is important. Yeah. So those are the precautions which we need to take.
Right. So, okay, there is another question here from Tamiz. Many leaders are suggesting that mask wearing will be the normal for next 2 years. What do you think, Dr. Saab?
Well, so I think mask wearing 2 years. So let's say that if our vaccine is introduced in the real world and that vaccine doesn't work, well, then we will not have an option. So we are guessing right now, right? But I guarantee you that we will get a vaccine. At least beginning of next year, we will have a vaccine. And once it is introduced and we say that, yes, it is effective, and we have really leveled the infection rate, or it has gone away now, I don't think people will on a normal. Now, if it has become a habit, there are lots of people who will continue wearing masks.
Yeah.
And they say it is a good thing, that it is preventing a number of us, to get other viruses as well.
Yes.
Yeah, that's right. So now you are right by saying that we'll open the schools and teach them all these precautions and continue with the teaching. So they're not going to have classes in the university, and why is that? Because they're thinking they can be learning online and the kids should go to school. So I think that is better than that the older people should be doing online learning and the younger people should be going to school. Do you think that is better?
Well, so I think the reason, remember your teenagers, their social habits are very different than your youngsters. And I don't want to get into what they do at the university.
Okay.
I've been teaching them for 35 years, so I know what they do.
Okay.
So I really will not get into that, So, and number two, those teenagers always think, that it is not going to happen to them.
Yes.
Yeah.
You have already seen the universities or colleges which has opened in the United States and what has happened within a day or two of opening that.
That's right.
All right. So there is I don't think, they believe in social distancing. They don't believe in any of those precautions. So I think, that's where the difference is between the younger age group and those students who are going to university. I think, that, well, there will be children or teenagers who will be going to universities, and university is trying to plan it this way, that to have fewer students and others doing it online. And then those students who are going to the university, they now do it online. And those who are doing online, they go back to the university. So they're trying all of these things out. Nobody has carved a way how we are going to do this. So we'll learn from our mistakes as well.
Yes.
But it will be a pricey mistake. Remember, that this is not, when we start seeing more and more cases of this, there will be more transmission and we may have to close down.
Yes.
Where we opened up the second stage, and people will say that, no, let's go back to the stage one opening now and close down the second stage at the present time. So that our time will tell us that, what will happen.
Yeah. Okay, there is one more question from Adil. It's about kids as well. If the children if children get this virus, how does that affect their lung scars?
Okay, so that's a good question. That whether and people have started. So I'll tell you what has happened. So in elderly people who have died, they've done autopsies of them, and in those autopsies, they have looked at that this virus does affect the lining of the lungs. Now I'm talking about elderly. Nobody has done studies in children in autopsy looking at that. So people will say that, well, it may happen in children, and it could happen in children. And so right now, as when you talk about scarring, we know of some of these viruses, and I'll give you an example of that. Respiratory syncytial virus, or it is commonly called in community, it is called Rsv virus. And usually it is the babies who get that. It happens every year. There is an outbreak of that, so we do see it during winter months as well. There are studies which have shown that those babies who get RSV, they are more prone to get asthma. Okay, so we know that some of these viruses do. It is too early to say with this coronavirus at the present time whether the same thing will happen or not. It's only time which is going to tell. The good thing is that because children are asymptomatic, I think, it does not damage the inner, because if it did damage the inner lining of the lungs, you will see the symptoms in children.
Yeah.
Because you are not seeing symptoms, so I think, that the damage may happen, but it may not be that drastic. So time is going to tell, and I'm sure they will study this. I'm pretty sure this will happen. because there are lots of people who are interested in looking long-term the effect of the virus. I know there is a group of people at the present time are looking at the effect of this virus in the brain. So there are studies being done, and they will be followed for many, many years to see, that what is the outcome. Similarly, in children, I know of group of researchers in North America have started looking very closely in number of organs involved with this virus in children as well. So we will have an answer, but I don't think it is too early to say what will happen to these children who were affected. Even those, so what they will do is that they will take these two groups of children, one who had lots of symptoms and one who was infected but did not have symptoms, and they will compare those two groups. So we will have an answer, but it will come.
Yeah. But good questions are coming, huh?
Yeah, that's right.
Yeah.
Could you want me to ask one more?
Who?
Me. Like, you want me to ask one more?
No. I said good questions are coming.
Yeah,
so
that's right. Yeah.
So today I was with somebody, and they said that so we cannot hug anybody if we are wearing our mask and we have washed our hands, and can we hug people with our mask or not? So that was a question was asked to me, and I really couldn't answer that. Can we do it or not?
Were you wearing a mask?
Yeah, with your mask and your.
No, were you wearing a mask?
I was wearing.
Or she asked you on the phone?
No, I was wearing a mask. She asked me like face to face.
Oh.
Yeah.
You can't hug anybody.
You can't hug anybody?
No.
Like, even if you're wearing a mask?
I'll tell you the reason. I'll tell you, even if you're wearing a mask, you can't hug anybody.
Okay.
Because as I told you, so number one, you have to understand the protection of this mask.
Okay.
If you're wearing it for a longer period of time, the protection of the mask is not very effective.
Oh.
Though you will be, there is a lesser chance of you transmitting the virus, but the effectiveness of this mask, which we use it in the hospital, that's the reason we change our mask frequently. That's number one. Number two, when you are hugging, and you touch the body, their body or the clothes, you probably are carrying the virus now. And you can transmit that virus very easily. So, for God's sake, you can hug me at home. That is fine. But you can't go and hug anybody outside.
Okay, so whoever asked me that question, I hope they are listening to it and they get their answer.
Okay.
Yeah. So, Dr. Saab, we are doing so much better right now. So, especially, I'm just talking about Canada. We are we are educating our people. Like the government is educating people about the 2 meter distance, mask, wash your hands, this and that, everything. Numbers are going down, sugar, but they're still talking about like a second wave.
Yeah.
Is there any chance for it? Because we are doing our best. Numbers are down. So still second wave can come?
Yeah, so Jalal, think about this. So those places where they have opened up things and you see the spread of the virus.
Yeah.
All right. So you may say that, yes, numbers are going down, which is an excellent thing, but there are lots of people not following those rules. And so the transmission of the virus continues to take place. All right. And you will see that it continues to spread from one to other person when you're not following the rules.
Yeah.
That's where the issues are. So I'll give you an example. Alberta Health Services initially did not make it mandatory for everybody to wear masks when they entered the hospital.
Yeah.
When they entered the hospital, which now it is a mandatory thing.
It is mandatory, yeah.
Yeah. So when I enter the hospital, I have to enter with the mask on. So I carry the mask in my car. And as soon as I enter the doors of the hospital, I'm wearing a mask. And I am checked right at the entrance, and I have to wash my hands properly before I enter the main part of the hospital. All right. Why did they do that? Our numbers were going down, but we were not seeing that impact of that. And that is the important thing, that everybody has to play a role. We are for each other.
Yes.
And if we don't, let me tell you, and if the vaccines are not there, we will continue to see the uprise of this virus. And as you are reading in the newspaper, every day, in Alberta, we see new cases of these viruses. Why is it happening? Because it's the same reason. There are lots of people. You go to the parks, and you see how many people, walking around closely, no masks, right? So that is the reason, that we need to do our best to follow these rules. People have started going for prayers now.
Yeah.
And you probably heard the studies which has been published in a church where they were singing a choir. And there were a number of people infected.
Yes.
And it has been shown, though it is not airborne, but when you speak, you are transmitting that virus very quickly, rapidly.
Yeah.
See, so that is the reason you wear a mask. You want to perform anything, you wear a mask, but don't sing with them. As soon as you start singing, your saliva starts spreading out in the air, and you're spreading the viruses.
But isn't the mask preventing it, or is still you can get it if you're singing and wearing a mask? So
well, you can get it, but most of these churches where they were singing, they were singing without the mask as well.
Oh, I see.
So I think that we have to be careful. As I told you, that the effectiveness of the mask is for a short period of time. So it will prevent you if you're not talking, you're not doing those things. It will still prevent, but you start shouting loudly, singing and choirs and all that thing.
Yeah.
I think everybody has to understand, that God has, in exceptional situation, He has allowed number of things in exceptional situation. Those things which are forbidden to us, in exceptional situation, He has allowed us to eat those things as well. People have to understand, Almighty God is merciful, and He forgives people. So we should not be rigid.
Yeah. Okay, I got one more question here from Samir. Okay, so there are a lot of COVID patients have permanent ailments. Is this true? And what kind of permanent ailments are we talking?
So when you say lots of people have got permanent, is this the comorbidity factor, or is it permanent illness, with the COVID-19? I need that level of.
I think COVID-19.
Yeah, with COVID-19.
Yeah, so permanent, we can't say that it is permanent because it has been there only for 5 months. So, they may have, so some people, so to give you an example, so I have seen children who had multi-system involvement with the COVID-19, which means that their multiple organs were involved with COVID-19. They were admitted to ICU.
Right.
The recovery time for them is much longer. But I can't say it is permanent because, we have had this virus for only 5 months now. And whether they will completely recover, it is only time which is going to tell us that.
Yeah.
So severely affected people, multi-organ system, it has taken them a long period of time. So the question comes up, that some people who get clots, all right, so this has been proven now, lots of people severely affected, they get clots in their veins. And so, they get better with your anticoagulants, but we don't know whether this is permanent or not, whether it will come back again or not. So I don't think we can say that this is permanent.
Okay, there is another question by Nisha, our Nisha Devani. Is it advisable to take flu shots?
Well, if you ask me, I'm a biased person. I'm an infectious disease specialist. I think everybody should take flu shot. Flu virus circulates, as I mentioned to you earlier.
Yeah.
It all depends on the strain which is, in the vaccine, in the strain circulating in the community. If both of them are matched, then the effectiveness of that vaccine is much higher. If there is a mismatch of the strain which is communicating and one which is present in the vaccine, then the effectiveness is not very high. But you should take flu shot. Let's say that even if it is 30% effective, your chances of going to the hospital is less than those who have not taken the flu shot.
True.
Also, I will tell you one other thing. Lots of people say that whenever I take flu shot, I get sick with it.
Yes.
Yeah.
And I'll give you a reason why this happens. It is not the flu shot which has made you sick. It is because we have got so many other viruses circulating at the same time. And the time when you took the flu shot, you probably were incubating some other virus.
Yeah.
And then you got the symptoms. So that is the reason, that people blame it on the flu shot and say that, oh, it is the flu shot, which made me sick. It has happened with me as well. I was supposed to get a flu shot at the clinic. And because I became too busy, I did not get flu shot that day. The following day, I had runny nose, cough, and all sorts of symptoms. So think about it. What would I have done, if I took the flu shot that day? I would have said it's the flu shot which made me sick.
Yeah. Definitely. Yeah.
Okay, there is another question from Narmeen, our good friend. Okay, how would seniors protect themselves from the PSWs who enter their homes to physically assist them?
Yeah, so I think this is a very, very good question. And we need to take care of our seniors. That's important. I think we need to ask few screening questions. Number one. All right, have they been all by themselves in that house, or some other people have visited them as well? We want to make sure that they do not have any symptoms. When you enter the house, you make sure that they sanitize their hands as well. They are wearing masks as well. And you do the same thing at the same time. So I think these are some common things which we can do ourselves very easily, making sure that we remain protected and we are protecting them as well. And that is important because seniors, they have got high morbidity with this virus. They have got high mortality with this virus. You really do not want to infect the seniors with the virus because the chances are they will end up in the hospital.
Yeah.
Yeah,
right.
Okay, there was a story, Dr. Saab. It was, I think I heard yesterday. There was a person in Hong Kong. He got sick in March, coronavirus. Then he got better. He was fine, perfect. And then last week he got sick again. He got reinfected again. So how much there is a percentage or kind of chances you can get reinfected?
And that story is correct. That is not a rumor.
Yeah.
All right. So the reason I'll tell you that it is not a rumor is because what they did was that they took when he got infected again, they looked at the molecular basis of the virus.
Okay.
Then they found out that it's the same virus which has caused the illness in them. Okay. So let me tell you that happens with other viruses as well. All right, and I'll give you an example why that happens. If you vaccinate people, depending on the effectiveness of the vaccine, okay, you will not be able to mount antibodies in 100%. It's very similar to some people who get infected. They will not be able to mount antibodies in their body. Numbers are not very large, but it happens. The reason you heard about this case is because this is a new virus.
Mm-hmm.
And he got sick.
Yeah.
So people are interested to know.
Right.
So that is the reason they went and looked at the molecular basis of the virus. Normally, nobody would have done that.
Yeah.
But there
That's
are
right.
so many things which we do not know about this virus.
Yeah.
And that is the reason people want to really learn more and more things so that we start really taking better precaution. And we say that, well, these antibodies, which we are looking at now, so they are doing studies as well, and they've published some of them. What they have done is that they've looked at those people who got infected, and they went and took some convalescent blood from them and looked at the serum and looked whether they have mounted the antibodies. And that is true for most of them, but some of them didn't. They didn't have antibodies. So you said that, well, I had the virus, how come I got sick? Well, you got sick because your immune system did not create those antibodies. To now, when you are infected second time, your immune, which is like an anti-missile. It is exactly like anti-missile.
Yes.
That rocket is coming, the anti-missile takes care of it. Those antibodies take care of that virus. So that is how it works. If you don't have antibodies, it doesn't. You will get infected again.
Yeah.
It's not that common, but it happens.
Yeah.
Okay, I got a last question, Salma. Yeah, is that okay?
Yeah. So
yeah,
my last question is that now we know we have taken so many precautions with coronavirus, and if another virus comes along next year or the year after that, will we be more prepared because we have gone through all this to combat that pandemic for another virus? Will this help us, all this what we are doing right now?
Well, I'll tell you the answer for that. That if you're asking me that, well, we will get another virus. That's for sure.
Okay.
Yeah.
If it is not pandemic, it's not a big problem.
Okay.
So I'll give you an example. Let's say that we get 2 years down the road, a bird flu virus been infected. Okay. Now that transmission of that bird flu virus into the humans, if there is no transmission between the human to human, it will not become pandemic.
Okay.
Pandemic only happens when there is human to human transmission of the virus, and it is a new virus.
Yeah.
It is a new, number one, it is a new virus.
Right.
And there is human to human transmission. And then it spreads very quickly because we do not have antibodies against that.
Yeah.
So the question you are asking, it's an excellent question, but I can tell you, if we have become smarter, then we will try to find out, if we can create a vaccine, because influenza is a common virus.
Yeah.
That if we can create a vaccine against all strains of influenza.
Yeah.
And if we have created that, then at least there will not be a pandemic with the influenza strain of virus.
Yeah.
Okay, that's a one family of virus. But you can get pandemic with coronavirus. Another coronavirus will come.
Yeah.
There are hundreds of coronaviruses which infect the animals and transmit it and from human to human. But you will not be able to have the vaccine. But I think science has progressed to a level that most likely in future, we will be able to produce the vaccine faster. Most likely. People now have learned the lesson.
Yeah.
Unless we have got crazy leadership in the world who don't believe,
Yeah.
and they said it will go away or it will just disappear, Now, if you've got crazy leaders like this in the world, they are putting the entire population at risk.
Yes.
And so I hope those kind of leadership is very few of them, and they disappear quickly.
Oh yeah, hopefully, inshallah. Yeah.
I'm not taking names of anybody, but yes.
Okay, so there is a question from Diamond. Okay, seniors living by themselves with asthma. Any suggestions?
Yeah, so seniors living with let's not only say asthma. Let's say underlying lung disease. Asthma is a risk factor that if they get infected with COVID-19, they are at a higher chance of getting sicker, much sicker. All right.
Okay.
I would advise those seniors not to come in contact with people, number one.
Yeah.
Number two, if their children are helping them or youngsters who are helping them, making sure that they are absolutely clean, in the sense when I use the word clean, I mean they won't know that they've got a virus today because if there are no symptoms, but to take good precaution when they go and visit them, to deliver food, to deliver medicine to them. But those seniors should not come in contact with large number of people. Anybody with underlying lung disease, anybody with underlying heart disease should try to avoid going for shopping, going and avoiding crowds. It is hard, I know. It is very hard. But for the sake of your health, you have to do this till we have got the vaccine with us.
Yeah.
Yeah. So, Dr. Saab, this is the new normal for us since March. And we have masks and 2 meters apart. So do you think this new normal will continue year to year at least until we have vaccination?
Well, it will definitely continue.
Yeah.
This is the only way you can prevent it right now.
Yeah.
So it will continue, and it should continue.
It should continue. Yeah.
It should continue till we have an effective vaccine with us.
Yeah.
Absolutely, it is so important that we have decreased the number of nosocomial infection in the hospital. You see, when people are admitted to the hospital, then we do see that other people get infected. But by taking all these precautions, we have decreased the number of other people getting infected in the hospital with number of other organisms. Important, very important.
Yeah,
that was nice.
Yeah, everybody is happy, thanking that they are happy with all the good information we got from you. So thank you once again for your precious time and for all your knowledge and all the information. And hopefully when we are done with it, inshallah, soon, then later, we will have you again and then talk about it in a different way. That will be so nice. Yeah.
But when we meet at home, give me a good hug.
Anytime.
So thank you so much, Dr. Taj. I think it was, it's an honor for us to have you, whenever you come. It's great information. Now, we are getting more and more about this virus. And guys, next week, Dr. Jalal and Dr. Salma will be available for your answer. for your answer. If you have any
questions and answers,
Thank you for having me. And anytime, I'll be glad to come back.
Love it. Thank you so much.